What's going on, guys? ECRG here. Hope you guys are having a good morning. Um, Actually, hold on. My mic isn't working correctly. Let me come back here. Disconnect my mic and come back. Hold on. How do I? Hello. All right, I'm back, guys. I'm back. So, let me see if I can present share screen window. All right, cool. Hey guys, ECRG here. Back with another live stream Q&A session. So I've been seeing something that's been coming across lately. I've been seeing something that's been coming across the news if you've been out there lately regarding this Boeing, um, these Boeing situations. I think that's really crazy. That's really crazy. So a lot of people in this industry obviously travel. A lot of people fly leisurely and they just fly in general. So if you are listening, definitely put a comment if this is something that's of concern to you, if this is going to affect which airlines you travel, if this is going to affect how much you travel. What is this going to affect? Just want to hear you guys' thoughts in the comments below. But This is definitely a big deal. I mean, you haven't seen, um, if you haven't seen, there's been a lot of things going on. So let me see if I could find a page with all of the issues here. Boeing one. So yeah, there was even this whistleblower. So look, United Airlines flight missing an external panel. This was just yesterday. Um, Boeing whistleblower got off plane. We realized it was a 736 Max. 737 issues. All right, let's see. Maybe here they will list out all the issues. How to think about Boeing's recent safety issues. This 50 people were injured when a 737 dropped abruptly mid-flight. The same day, the New York Times reported that a FAA investigation found that the company failed 33 of 89 product audits where the planes are being built. So it's with underscoring air travel remains extremely safe. Okay. This is what I want. Profits over planes. So these planes have been riddled with issues. Work on whistleblowers complain about serious safety problems. Um, then I don't know, this whistleblower, you guys can research, John Barnett. He's been talking about all these issues, and guess what? He was found dead. Um, and he said if they say it's a suicide, it's not. It wasn't him. So this guy's been coming out for years talking about this. So I don't think there's been any like deaths regarding these issues, but it just seems week after week there's issue after issue, issue after issue, with these Boeing planes. So it kind of gives you cause to think about: is this going to affect our industry? Is this going to affect um, clinical research in general? Is this going to affect other industries? So it's definitely something to consider and think about. So if you have any questions regarding that, please put them in that. Please put them in the chat. So it's definitely interesting. Um, Here we go. Let's get a banner going. It's definitely interesting, guys. So now I think more than ever, people are going to be looking at, okay, which plane am I actually flying on? How long am I flying on this plane for? You know, those type of things. Which airlines use these planes the most? Seems like it's United. So are we going to stay away from United? Like all these airlines are definitely going to have to pivot from away from this plane, because I think Boeing just has a bad name now. And the fact that they failed 33 of 89 audits is crazy. That's more than a third that they failed at the factory. So clearly these planes were not built correctly and with the proper standards and safety patterns that they should have been planned, or built with. So that's a shame. But yeah, I'm definitely curious about what you guys think regarding the Boeing disasters that's been happening. I mean, we've seen the plane door fly open on a plane. We've seen, just issue after issue dealing with the Boeing. So I think, if you want my prediction, I think United Airlines is going to get rid of that Boeing plane quick, because it's hurting their brand just as much. Whether it's their fault or not, it's obviously Boeing's fault, but they bought all these planes, so they can't really use them. If passengers are going to be afraid to fly with them, they're going to start getting competitors. They're going to start booking competitors. So we'll see. We'll see. But I think it's definitely a cause for concern if you fly United. Definitely a big cause. So yeah. So let's go ahead and get into some of the clinical research topics. Clinical research topics. Um, let me see. Do we have clinical contract? Let's go. Indeed. Let's see. We got North Carolina. I think we should just see wherever we can. I mean, well, this is fine. So I've been hearing across the industry, guys. I've been hearing across the industry that clinical research tractors are getting laid off. I've been hearing across the industry that there's been a overall slowdown when it comes to hiring of contractors and people in general right now. A slight slowdown, not major, but there's definitely been a slight slowdown. Um, so, what do you guys think about that? Are you guys seeing that as well? Are you guys hearing that as well? If so, what roles are you seeing being impacted the most? Um, so there's definitely still jobs out there, guys, though. Do not be confused about that. There's definitely still roles out there. Let's look in Los Angeles, North Carolina, Los Angeles. So we got out here in LA. Clinical research coordinator, great entry level role. I'd be careful about this one though. That doesn't seem like they talk about lab coordinator. That's typically not what we do. But yeah, guys, what are you thinking? Do we have any questions yet? Doesn't look like it. Wait, do we? Let's go over here. Anyone ask any questions? Let's see, comments. Nope, no questions yet. Yes, I haven't seen that. I've heard that when the economy goes down, contractors get cut first. So if you're a contract CRA, contract project manager, contract data manager, etc., all the contract workers get cut first. And it's unfortunate because you got to do great work, but that's typically how it goes. So if you want more stability, you want to go with full time. If you want more money, but it's going to be less stability, you want to go contract. So I'm hearing that they get first, and they're not being hired a lot right now. So that's what I've been hearing, guys. Company I work with, they do hire contractors, but we've also been hiring full time because people aren't really liking the contract because of the, how do you say it? The roller coaster ride. 1 week you're working, the next week you're not, and they don't give you 2 weeks notice. When you're a contractor, they don't give you 2 weeks notice. They might give you 2 days notice. They might give you 1 day's notice, or they might say, finish out the rest of the today and then send your laptop back in. So that's kind of how it goes when you're a contractor. They don't give you the 2 weeks notice that you might be accustomed to when you are a full-time employee. And it's unfortunate, but that's how it happens. That's how it happens, guys. But on the flip side, when you're a contractor, and I'm just going to use contract CRA for an example, you might get paid door to door. So when you walk out your door in the morning to when you get to the door at the hotel, you're getting paid the entire time. When you're doing work, you're getting paid every single thing. If they want you to do some BS type of work, like some redundancy, stupid stuff, you're getting paid for it. If they want you to come to the office, which they won't because they got to pay you for it. Yeah, guys. So there's benefits to being a contractor. Lots of benefits. I work a company that likes to have a lot of in-person, face-to-face meetings. And guess what? the contractors aren't there for half of them because they'd have to pay them a lot of money to be there. Every hour, you have to pay them to be there. So there's a lot of benefits to being a contractor, but there are the drawbacks as well. It's like with every role that you take. There's benefits and drawbacks. Benefits and drawbacks. So if you guys have any questions, drop them in the chat. Drop them in the chat. So I'm still seeing, if you are aggressive, if you follow my strategies, if you follow my tactics, you will be able to get a role in this industry. If you aren't aggressive, if you're not using a great strategy, it's going to be hard for you. It's going to be hard. Let's see what we've got around here. Let's see what we got around here. The #1 clinical research organization. Oh yeah, IQVIA. Who are the major players? Okay, interesting. But yeah, guys, if you guys have any questions, please drop them down below. Just wanted to see what the audience is going to be like for live, and I want to talk about this Boeing stuff. Definitely want to talk about this Boeing stuff because that's been kind of scary. It's been kind of scary. But anyway, guys, hope you guys having a good weekend. I'm gonna go ahead and end the stream here. We don't have any questions or anything. I'm sure if I did these more often, there'd be more people involved. And also, I kind of set this up last minute. I think people tend to do more of this during the week. It is Sunday. But anyway, guys, I'm gonna go ahead and end it here. Email me eliteclinicalgroup@gmail.com if you have any questions, if you want your resume reviewed, interview prep, LinkedIn review, etc. All right, take care.